Greetings to all. I, Dr. Kamala V, and Dr. Vijay Batra, executive members of Academic Council of Occupational Therapy, both from New Delhi, are host of today's pre-conference continuing Occupational Therapy Education Program of this 58th Annual National Conference of All India Occupational Therapist Association. This CME PRECOTE has been held virtually today evening as per Indian Standard Time. We, on the behalf of Academic Council of Occupational Therapy, welcome the President AIOTA, come Executive Chairman, Academic Council of Occupational Therapy, come Organizing Chairman, OTICON 21, Dean, ACOT, come Organizing Secretary, OTICON 21, Chief Guest of today's program, and other dignitaries. Speakers of today's COTE, other executive members of Academic Council of Occupational Therapy, executive members of AIOTA, Organizing Committee, OTICON 21, and our delegates. Academic Council of Occupational Therapy, the constituent body of AIOTA, maintains the standard of education as well as conducts academic courses in occupational therapy, including pre-conference COTE every year. Continuous professional development is a key to the future. Albert Einstein has very rightly said, intellectual growth should commence at birth and cease only at death. The most valuable asset that all occupational therapists have is each other. Without collaboration, our growth is limited to our own perspective. Considering learning as a prime motto, this year also ACOT is conducting today's pre-conference COTE virtually in this pandemic situation. With this novel thought, let us start this program by lighting the lamp in front of Goddess Saraswati, the symbol of knowledge and wisdom. I now request Dr. Jyotika Bijlani, Dean Academic Council of OT, come Organizing Secretary of OTICON 21, to address us about today's program. Madam, please.
Good evening, everyone. Dr. Anil Srivastava, the President of AIOTA, Executive Chairman of ACOT, and Organizing Chairman of OTICON 2021, will not be able to attend this function due to some unavoidable circumstances. He has sent his apologies for that. He has been the strongest pillar of AIOTA with his exemplary vision towards the organizing this unique event of OTICON 2021. On behalf of Academic Council of OT and entire fraternity of AIOTA, I'm extremely happy to welcome you all to today's function. My chief guest of today's function, other dignitaries, the distinguished speakers and delegates, colleagues, and my dear students. Today's function is on continuing occupational therapy education, which has been always been organized during every conference. As rightly said by Henry Ford, anyone who stops learning is old. And anyone who keeps learning stays young. Therefore, my friends, continuing occupational therapy education always been regularly organized by ACOT to keep you all occupational therapists ever green and young. And occupational therapy professionals consistently face the challenges to address the specific rehabilitation needs of the individuals with multiple disabilities, may it be physical, sensory, or mental disability. The challenges keep on popping up during the OT practice. Considering the concern of professionals, AIOTA decided to organize COTE on breaking through the occupational therapy practice challenges. Dr. Atul Jaiswal, who is from Canada, but original spice, occupational therapy spice of India, he is going to speak on the role of occupational therapy in rehabilitation of individuals with concurrent hearing and vision impairment. He will add some extra ingredients to this topic and prepare the occupational therapist with skills, knowledge, and aptitude to work effectively with people having dual sensory impairment. In the difficult period, uncertainty is a certainty, and we should be ready for handling any kind of uncertainties in our life. These uncertainties give rise to many challenges in our occupational therapy profession, also which needs to be effectively managed. So the 2020 pandemic has pushed all the occupational therapists to rapidly adopt the tele-rehab for their patients. For this, the therapist must be using the assessment that are well suited to tele-rehab. Dr. Namrata Gram-Purohit from USA, again, one of original Indian occupational therapists, will add some important spices on the OT practice in challenging situations. Her topic is computer adaptive testing in occupational therapy, innovative assessments for tele-rehab. It is truly said by C.S. Lewis that the task of an educator is not to cut jungles, but to irrigate the deserts, which our amateur occupational therapists proved it during the pandemic crisis. The practice of most of the professionals were affected, and therefore to keep up with OT services for the clients, many innovative ways were invented to use these different methods of occupational therapy practice in traditional way. It is interesting to debate on such difficulties faced by our younger group of occupational therapists, whom we invited as panelists and who would be sharing their experiences as how they coped up with the challenges posed in the pandemic situation. The topic to be discussed is skills, challenges, and occupational therapy practices. Dr. Balaji Bhaskaran from Chennai, who will share his strategies used for managing financial breakthrough in his private clinic during the crisis. People like Ojaswita Sharma and Dr. Disha Sanghvi, who changed their mode of practice, but they continued it by using their skills of athletic activities or art creativity on online platform. While Dr. Seema Awasthi will share her strategies in coping up with difficulties she faced as a new startup. The moderator of this panel discussion is our great mastermind, Dr. Manish Samnani. I'm sure it would be interesting and enriching experience for all of us through their presentation on this subject. This would certainly help we all in improving our practice in this field. It is a good opportunity to take advantage of the expertise and interact with them to learn and update the knowledge on this subject. With this, I will complete my speech by using quote by Krishnamurti that learning is a movement from moment to moment. So keep learning, stay young and healthy. Thank you.
Thank you, ma'am, for your enlightening us about the importance of today's COTE. Our chief guest of today's program is Dr. Mohan Joshi, Dean, Lokmanya Tilak Municipal Medical College and Hospital, Mumbai. Dr. Joshi is a surgeon by profession. During last year, he was associated with the development of Seven Hills COVID Hospital in Mumbai. He has also been the Dean of Topiwala National Medical College and BYL Nile Hospital, Mumbai. As a professor of surgery, he has enormous academic and research achievements to his credits. May I now request the chief guest of PRECOTE to deliver his inaugural speech.
It gives me an immense pleasure to give this inaugural speech for a pre-conference CME of 50th Annual Conference of Association of Occupational Therapists of India. Occupational therapy carries a great significance in every hospital, and we have a postgraduate institute of occupational therapy. The Association of Occupational Therapy of India is quite active in disbursing knowledge and newer techniques in occupational therapy. This is the 50th Annual Conference of Occupational Therapy, and I am happy that the pre-conference workshop, which is a satellite workshop or which is a Zoom workshop, which is taking place in Sion Hospital. And I am also proud that a student of Sion Hospital, past associate of Sion Hospital, Namrata Gram Purohit, who is working presently at Philadelphia in USA, is participating and delivering deliberations on tele-rehabilitation. The Zoom conference and the teleconferences have come up during Corona, and it's a new emerging concept which is sometimes better than formal organized conference. Mr. Jaiswa, who is from Cuttack and India, presently working in Canada, is also speaking in this CME. I mean, this CME, pre-conference CME, will definitely add a lot of knowledge, will enlighten a lot of things to our junior occupational therapists of the country, and especially the postgraduate students of occupational therapy. Our ex-head of the Department of Occupational Therapy, Jyotika Bijlani, and Shailaja Jariwan, who are relentlessly working for this CME to make it a grand success. I congratulate all of them. Thank you so much for allowing me to be here, and I am indeed happy and grateful.
Thank you very much, sir, for your kind and inspiring words. With this message of the chief guest, the pre-conference PRECOTE is being opened.